I want to look at another complication of supracondylar fractures. So when supracondylar fractures occur, they come with this complication, and this complication is injury to the brachial artery. Injury to the brachial artery. So the brachial artery kind of like you know goes around this elbow joint. So there's fractures here. The brachial artery could actually get fractured, injured. Can bleed. So it's one of the complications that you always check once you hear that a patient had a fracture there. So it's actually one of the most feared complications of supracondylar fractures, especially in children. So how the injury happens, the sharp displace, that's like when there's a fracture, all these sharp ends of the bone, they are the ones that could actually what puncture the blood vessel. Do you understand? So it's the fragments there that can trap, kink, or lacerate the brachial artery. So it will bleed and it will actually cause a swelling there or collection of blood as hematoma. So in severe displacement, the artery may be transected or thrombosed. You know. So clinical signs is absent radial pulse after injury, then pink pulseless hand. Okay, pink pulseless hand. So they can't be able to feel the brachial pulse again. So also your hand could actually become whitish by the time that the blood supply is now being reduced, because the blood give your hand that color, you know. So there's pain, there's paresthesia, and the tense forearm. So immediate assessment is anytime somebody has a fracture around the elbow, you always check if there's injury to the nerves or injury to the blood vessels. They check capillary refill, check for the temperature of the hand, you check for the color of the hand. And also you can use Doppler ultrasound to see how the blood supply is being maintained in that side. So management principles, if the hand is warm and perfused, observe closely, monitor for deterioration, as it's going down. So once the hand become cool, pale, it's an emergency and they can actually do a surgical exploration so that probably if the blood vessel is trapped somewhere, you can release it from the place that is trapped. So free the artery if entrapped, repair lacerations or thrombosis. Then you can also use venous graft if the artery is like completely cut. So that's what we have.